Big Hits WBTC. And it's time now for the 8:30 High Beam with everything going on around the studio today. I got Dr. Timothy McKnight in. Doctor, how you doing today?
I'm doing good. I had my head turned the other way.
It's wonderful to have you here. You know, I don't get that much of a chance to talk to you too much on the air because Brad's always working. So, But we want to talk a little bit about knees. And everybody, either you have a bad knee or know somebody that has a bad knee. And we're going to talk a little bit about that today.
Right. There's common knee injuries, and we've talked about knees and different aspects of knees in the past. A lot of people, especially when you're younger, you start running and all of a sudden you have knee pain or pain on the side of the knee, and that's actually a tracking problem. The patella or the kneecap is supposed to track right in the middle of there's a groove in the thigh bone, the femur, and if it gets off track a little bit, the patella or the kneecap bone will rub incorrectly against the femur and cause a lot of pain. That's because you've got a tendon on each side, and each of those tendons are pulling. Most of us tend to be a little tight with the outside tendon, so it pulls the kneecap out of the center line and off to the side, and it rubs on the knee bone. It can cause a lot of pain. So that problem is corrected with stretching and strengthening the inside muscle of the knee to kind of put the tension equally on both sides of the knee. I don't know if that makes sense. It's always hard without a visual, but that's a common running kind of a problem for somebody that's younger. But as you get older, it tends to be arthritis and those wear and tear injuries, and a lot of people will have swelling, and you'll wonder, okay, what's going on? Swelling is an indication of a possible tear of the meniscus, and some people, as you know, will have a tear of the ACL and have a bad injury and not realize they've torn it. Most of the time, the ACL injuries are pretty obvious. It's a typical, you put your foot down and the foot stops, but everything else shifts forward.
That's exactly what happened to me. And something bad really happens at that point, and you don't know what the prognosis is and how bad it really is. Did it tear everything out?
Right.
Did it, tear both meniscus? Who knows?
It's painful, and there's usually bleeding involved, so it can get black and blue, and usually swells up pretty significantly. But that's really, as we were talking before, you can do an exam, and if the knee is unstable on an exam, you can make the diagnosis. But an acute injury, when there's immediate swelling, it's difficult because it's so painful and it doesn't move much. But often, like a football player on the field, if they will let the examiner move the knee, they can usually get a pretty good idea or suspicion that it's torn. But the ultimate diagnosis is made with an MRI.
Yeah, I mean, an X-ray, of course, is not going to show it. Now, it does show maybe small fractures and things like that, but the MRI was very specific, and it said a discontinuation of an ACL, which means it's completely broke. And when the meniscus gets injured, which happens quite a bit with those, I'm assuming, that's where the problem seems like the pain is coming from.
Yeah, that's the recurring pain. And some people who have an ACL injury or a tear, if they're younger and they're active and they want to remain active in sports and activity, they'll go ahead and repair it. It can be a lengthy rehab. It can be 6 to 12 months.
I was told at least a year.
Yes,
for me.
Yes, yeah, because the older you get, the tighter the tissues are, and the more it takes to try to restore that range of motion.
Yeah, and I was asked if I was going to be participate in any professional sports, and I kind of laughed at the person. However, when you think about it, as you get older, we talked about this before, your mind is great. Your body's saying, oh, we got to slow things down here a little bit. But your mind's saying, oh, I can do all this other stuff.
Sure. You're at a picnic and they're hitting a softball, and pretty soon there's a game, and you're thinking, well, I don't know if I can do this. But they say, come on, you just play first base. And then, then you're up to bat, and then you're rounding the bases. And before you know it, you're thinking, this doesn't feel like it felt 20 years ago, and something can happen.
Right. And, I played softball after I had the injury. And I said, I'm not going to swing a bat. I'm just going to swing with my arms, because I would have had to take it out. And a pitch came in, and I forgot, and I planted my knee and twisted, and it went down into a heap.
Yeah,
screaming like crazy. It happened a couple times.
And that may have been when the meniscus was torn. You can tear the meniscus with that initial ACL tear, but there's two cruciate ligaments. One is posterior and one is anterior. The ACL is the anterior one that comes in the front. So you still have one intact, but it really makes the knee unstable. The knee shifts, as you know. It feels unstable. It'll move around more than it should, and that extra movement puts pressure and a torquing motion on the meniscus, which is the pad between the upper and lower leg bones, and that's when those tears happen.
Yeah, and it's interesting too. I can't put any weight on it, and 15 minutes later I can walk on it fine. But there's a lot of pain, swelling, fluids, and stuff like that. Right. And then you start to feel better. Then you go out and step in a hole.
And that's sort of the mystery for people. Why does it sometimes swell and hurt, and other times it doesn't really bother me? That doesn't make sense. But those tears often are, if you think of a bucket handle, and when the bucket handle is in one position, everything lays flat. But when it goes the other way, it doesn't lay flat. So it's like a foreign body in the knee, and that's when you have the pain and the swelling. It feels like it locks or gets stuck when you're trying to move it. But when it's laying flat like it should lay, you don't have much pain. You don't really have any pain. You don't have any swelling. But it can flip back and forth in there. And when it flips the wrong way, it's like something is in there that shouldn't be there.
Right. And now some of the remedies for that, I know knee scoping to do things with the meniscus is one of the first things that the doctor had said.
Yeah, that's probably the classic traditional way to do that, is to clean up those tears and to smooth them down. I'm not an orthopedic surgeon, so I'm not sure besides smoothing that down. I've seen that done, but I'm not sure if there's anything else they can do. Is there an adhesive they can put in there? If there's an extra fragment or a small fragment to kind of stick it, keep it flat against the rest of the tissue. Sometimes as the cartilage wears more and more and you lose more and more cartilage, so there's less padding there, that's when you're getting close to thinking about a knee replacement, because then it's bone on bone. But that is a cartilage material, and stem cell therapy can be a nice option for some people, because you put stem cells in, and stem cells are just immature cells that don't know what they want to be when they grow up. And when they get close to that cartilage, they say, that we must be cartilage. So it'll lay down more cartilage and potentially help it to heal. But that's a really new approach. And for most of the people, they're not candidates for that. But, I would always consider that if you're young, relatively young, in your 50s, maybe 40s, that would be something that might be an option for you. But eventually, you're probably going to want that fixed, because when those tears persist over and over again and you get more wear and tear, it's just accelerating the degenerative process. And eventually, like I said, you're probably going to need a knee replacement.
Yeah, the other thing, technology's gotten so far along that, when you go to do some of these things, you're up the next day. You can actually even do activities within 4 weeks, normal activities, of course, with a brace. But, it's amazing that you're not laid up for any length of time when they go in and do that.
It is. And we're doing more and more of those arthroscopic procedures, whether it's a gallbladder or an appendix. If we can just poke a few tiny holes in, the injury and the scarring, the inflammation that comes post-surgical is much less, and the recovery is a lot faster. And that's one of the reasons why the arthroscopic surgery is usually a pretty quick one to recover from.
Dr. Timothy McKnight with us here on 830 High Beam today. Doc, I appreciate you coming in talking about knees.
No problem.
We'll keep in touch, and we'll let you know what happens on mine. I know the worst thing happened when you get in a car. Your knee twists when you get in. I was at the Humane Society, and I let out a roar, and I had all the dogs out there barking after that because it hurt. I mean, it's just like somebody hitting you with a sledgehammer. So it's
well, when you play softball next time, have them play in a small field and just make sure you hit it over the fence so there's no running involved.
Well, that was just the other problem. The time where I got hurt, I hit it over the left fielders. I had to run. Well, that was like, I rolled, crawled, and flopped around a little bit. So, Dr. McKnight, thanks for coming in today on the 830 High Beam. And it's brought to you by Mako's Pharmacy. They have all your great supplementals and vitamins and things there, so check them out. And you're listening to the B-Team Morning Show on Big Hits, WBTC.